coronavirus in Georgia.
But there's no need for people to panic.
But as cases spread in our state, it's changed life as we know it. Schools shut down.
Next door where my child goes, yes, it's very scary.
Stores running low on some essentials.
Because I knew the shelves were going to be empty.
And medical facilities pushed to their limit.
Many of our supplies are running critically low.
Tonight, members of the Coronavirus Task Force and Georgia's governor answer the most pressing questions and lay out their plans to stop the spread.
In this time of need, I'm asking Georgians to support their neighbor because we are all in this together.
This is the governor's statewide town hall.
Good evening, everyone, and welcome to the governor's statewide town hall on the coronavirus. I'm Jovita Moore at WSB Television here in Atlanta. Throughout this hour, we'll be speaking with the state's top leaders in charge of the task force responding to this crisis. The spread of COVID-19 is affecting all of us. In an unprecedented collaboration, 6 TV stations are teaming up tonight to bring you the important information you and your families need. This town hall is broadcasting in all television markets across Georgia, including Atlanta, Augusta, Columbus, Macon, Savannah, and Albany, as well as on hundreds of radio stations and online. My colleagues and I will be speaking with task force members in a moment, but first, let's take a look at how we got to this point.
February 28th, Georgia's Governor Brian Kemp convened the first meeting of the state's newly created coronavirus task force.
But we got a great team assembled. I think you all bring a lot of different dynamics to the table.
3 days later, on March 2nd, Georgia's first confirmed cases of COVID-19, a father and son in Fulton County. A week later, there were 6 confirmed cases and another 11 presumptive positive. The same day, Fulton County school officials announced they would close all schools and offices after a teacher became infected.
I don't know what's going on, but they didn't call me. I don't know. I just came and got my kids because he sent me a message and told me to come get him.
March 10th, the number of the confirmed or presumed cases grew to 22, including the first in South Georgia. On March 12th, Georgia's officials reported the state's first coronavirus-related death.
You may be spreading the virus to others and not be aware.
Governor Kemp declared a public health emergency.
Felt like with this unprecedented event with the COVID-19, it certainly warranted that.
With schools closed and most Georgians now working from home, this week some cities issued shelter-in-place orders.
And here is where the situation stands tonight. The number of confirmed COVID-19 cases in Georgia jumped to 1,525. To help put that in some perspective for you, there are more than 10 million people here in our state. Today, the governor issued an executive order to close public schools through April 24th. Unemployment claims are soaring in Georgia and across the country. 12,000 more Georgians filed for unemployment last week. Tonight, for this town hall, we are joined by the state's top leaders in charge of handling this crisis. We will be hearing from them throughout this hour. We begin with the governor, Brian Kemp, who joins me here in our studio. Good evening, Governor.
Good evening. Thank you so much for having me.
So this town hall like this is unprecedented. You really wanted to make sure to get out this message statewide. So give us an overview right now. Where do things stand in Georgia tonight?
Well, first of all, let me thank everyone for joining in tonight. Thank all the media partners for this really unprecedented event of this statewide town hall so we can continue to be transparent with where we are, share the information that we need to get to our citizens so that they're educated, because it is going to be us. It is going to be us as Georgians to beat this virus back. There's no cure right now. There's no vaccine. And it is up to all of us to get educated and to do our part to be victorious in this battle. I also want to take the opportunity to let those families know that have lost loved ones to this virus that we continue to pray for them. We're continuing to pray for those frontline healthcare workers and public health officials, first responders, and a lot of other people all over the state that are on the front lines every day putting their lives at risk. We are grateful for that, and we will continue to be grateful for that. But I look forward to talking tonight about where we are and what we need to do to end this battle, and I just want to thank everyone for joining us.
All right, Governor, thank you. Let me start off by asking you this question. So many people in Georgia feel like you need to order a shelter in place for everyone. Cities, towns have come out, counties have come out in the past week or so to issue their own shelter-in-place warnings. Dr. Carlos Del Rio, epidemiologist with Emory University, says that it's almost too late. If it doesn't happen now, asking for a 2-week shelter-in-place across the state, he describes it as catastrophe. Why not do that?
Well, I've been listening to the data from the public health officials and Dr. Toomey. Let me just say our team, Dr. Toomey, the other folks that will be joining the town hall tonight have done a tremendous job of keeping me informed and helping the local communities. We continue to be in touch with communities all across this state. We continue to work with our task force, which has just the brightest of minds in our state, people from Emory and other healthcare facilities and Georgians that are close to this pandemic that we're dealing with. So I've gotten a lot of great advice, and I'm making decisions based on that advice. But I'm having to govern the whole state. It's much different than certainly what Mayor Bottoms and other local elected officials have done. I've been in discussions with all of them about ways to handle this. I'm supportive of the actions that they're taking, much like the President and the Vice President are doing. We're following their advice of Dr. Birx and Dr. Fauci. As well, and they are supporting the nation's governors who have all taken different tacks to deal with this virus. But, you know, the day that, or Monday, I guess it was, when we did the recent order with closing bars and restaurants, sheltering in place the elderly and medically fragile, and locking down events with 10 people or more unless there were social distancing parameters in regards to that. I was also talking to local elected officials in parts of our state that have not even had a single case yesterday, as of that time, and we still have over 50 counties that don't have a confirmed case yet. So, you know, trying to balance all those things, continuing to go on the data that we have, and supporting local elected officials. I did that in Albany. I asked over a week ago if they wanted me to take action to help them with the hot spot we have down there. They asked me not to do that. They wanted to handle that locally. A week later, I was on a call with all the local elected officials, not only in Dougherty County, but surrounding counties, as they all came together to take action. And we have a lot of resources on the ground down there, but that's why I've made the decisions that I've made. I still have arrows in the quiver, if you will, if things get worse. But my case tonight to Georgians is, if you will help us stop the spread, continue to fulfill the 15 days that the President, the Vice President, and the National Task Force to stop the spread. We've got a few more days to go. We have about 10 days to go on the recent action I took. There's a lot of great things going on at the local level. If we can get our citizens to follow these directions, it will absolutely turn this curve. We can get on the other side of this virus, and it's critical that we do that for our healthcare system. We are in contact with them daily, our hospitals across the state, working to procure supplies that they need, whether it's ventilators, PPE material, extra beds that we're preparing for, you know, if and when a surge occurs. So, you know, all of those things, but it's really up to the public to cut down on the number of people that we have to go to the hospital, and we do that by what I targeted in my order, and that was to protect the elderly and the medically fragile. That is the key to this right now.
Governor, thank you for answering that question. We may touch back on that topic in a moment throughout this hour, but let me ask you this next. Of course, testing, you talk about healthcare workers in the system right now. Talk about testing. Are there enough kits in Georgia? Where do we stand on those test kits right now?
Well, you can watch the numbers, and I would tell people, don't get too alarmed by the number of our positive cases going up. The number of our testing every day is going up exponentially as well. Dr. Toomey and I both talked about that weeks ago, that as we did more testing, we're going to see more confirmed cases. So that is proven to be true. I think you'll continue to see, and Dr. Birx talked about this at the federal level the other day. We got to get to a level in our state and in our country where we're doing the same amount of testing basically across the state and across the country, so that we can continue to measure the data. I feel like, you know, hopefully we'll be there in another 4 or 5 days, maybe 6 or 7. I think you're getting a good handle on the data at the federal level, and we have whole teams of people working on the data that we're looking across the state. But right now we have 10 counties in Georgia that make up 60% of the cases that we have. And there's 6 counties across the country. When you think about the whole United States, there's 6 counties across the country that represent 50% of the cases in the United States. So we have to continue to test more. Dr. Toomey and her team has done a great job. The private sector is now testing. I had a great conversation with something that we're working on that will hopefully ramp that up even further in the days to come. And that'll continue to give us more data. One of the problems that we have had is, and you'll hear this from hospital officials, is that the private sector test, it used to be taking 6 to 7 days to get the results back. Now, in some instances, and probably more than not, it's still taking 4 to 5 days to get the data back. We need that test to be able to get back, in 2 days or a day. And there's some tests that are coming out now that have been approved by FDA. And I talked to Director Hahn the other day about those type things, that you can get test results in 15 to 45 minutes. And that is where we need to get to be. But we can't just be so focused on testing that we're not focused on how we curb and flatline the spread of this virus, which is us practicing social distancing and other things. Right now, we're still getting guidance from CDC, and I'm sure Dr. Toomey may relate to this and reply on this as well in her comments. Still preserving those for frontline healthcare workers. We absolutely have to keep that workforce in the game to be able to do that. We have to be able to test them and make sure that they're not working in a hospital environment if they are positive, so that's critical. Our first responders, we need to be able to test them, and then as well as those really medically fragile patients. And then the rest of the population will come after that from the protocol that's coming from CDC. Now that's going to change as we continue to get more private sector testing. The good thing is, a week ago we didn't have 23 testing sites up in every region of the state, and today that we do. So we do today. We're making more progress on that every single day.
Governor, thank you for that insight and your explanation so far. We'll have more questions for the governor. He'll be with us throughout this hour. We're now joined by Russ Spencer with WAGA Television. Russ is standing by with Dr. Kathleen Toomey. She's Commissioner of the Georgia Department of Public Health. Russ?
Jovita, thanks very much. Dr. Toomey ran the Fulton County Health Department before assuming her statewide role. She is an epidemiologist, which means that she is a disease detective. She trained at Harvard, has held leadership positions at the CDC, including the country director in Botswana working with HIV. We're very blessed to have your expertise with us tonight.
Thank you.
And you can break some news for us. The numbers are higher. You have access to the public health department.
The numbers will continue to go up, and you'll see that this is something, as the governor said, as we do more testing and as the virus does spread in some communities, we will continue to see increasing numbers.
And what is the number now?
It's about 1,600, 1,650, and it's going to, by morning it'll be higher. But I'm less focused on the exact number and more focused on how we can get individuals to think about prevention. And if I could say a few words just about the virus, because I think there's a lot of confusion in the community, even in my own community down the road, because what's coronavirus? And somebody said, I see on Lysol that it kills coronavirus, but this was made before this outbreak. And in fact, there are many coronaviruses. The common cold is a type of coronavirus. SARS and MERS that happened several years ago are a type of coronavirus. This is a novel coronavirus, which means it's new. And it's brand new, newly recognized. It originated, as we believe, in China, but has spread throughout the world. And it was introduced in the United States and has spread across the country and very, very quickly.
Oh, let me ask you, do you see anything in the data that suggests that the social distancing we've been doing in Georgia is working?
I would say yes. I mean, the social distancing in some places began earlier than others. And places like Rome, which had some of the earlier high case rates, and we saw that related to an outbreak related to church attendance, and with large gathering. We have seen now that cases seem to be leveling off, but it takes a minute. Remember, this virus takes about 2 weeks, has an incubation a period of as long as 2 weeks, so you're not going to see immediate action. And the idea isn't that we'll prevent every case, but we'll slow the spread. as the governor said in his opening statement, we want to flatten that curve, and the reason you want to do that is you want to keep people out of the hospital, flooding the hospitals in a way that we can't care for people, and that's what you're seeing in Italy. That's what you're seeing in other parts of Europe.
Right. Now, the governor is consulting with you, obviously, but he's got other things to consider. He said he didn't want to do a statewide lockdown in one interview because there are a lot of folks still doubting the effects of the coronavirus in some parts of Georgia. But from a purely scientific point of view, I'm not trying to get you into an argument with the governor, but from a purely scientific point of view, would that be a good thing for the state?
Well, let me say this. I'm not going to. You're going to get me into trouble. I've thought a lot about this. I have friends in Cedartown. I have friends in Hoboken, north and south. I live here in Atlanta. You know what's good for Atlanta, which is, I believe, the correct thing that Mayor Bottoms did, may not be the correct thing for these other areas right now where they have limited spread. And if you look at CDC's guidelines, the guidelines are tailored to the community and what the epidemiology is in that community and how things are spreading. And I think we, in some cases, can be doing contact tracing very aggressively, still where the spread is relatively slow. In other areas like Albany, we really need to be doing very aggressive community mitigation. So it depends on the community where you're located in.
Governor Cuomo of New York, where the problem is the worst, said today that no matter what they do, even if everybody locks down, the hospitals are going to ultimately be overwhelmed there, that they don't have enough protective equipment for the long term, or ventilators for that matter. Do we have enough protective equipment for our nurses and our doctors, and enough ventilators for those who get critically ill?
We are really working hard to ensure that we stay on top of that. We are working with our federal partners. We are working, GEMA is on top of that. We are working with private vendors as well. So we're not just relying on our federal partners to help us. We are assessing the needs of the hospitals constantly. We have our first shipment of ventilators coming in to help some of the harder hit areas like Rome and Albany, and we're still keeping track of that. So that's something that we want to be very, very cognizant of. We're actually looking, which I think is a creative thing to be doing, where are some other opportunities to identify ventilators in the system, such as technical colleges and our university system, where there's teaching done with the ventilators. We can access those now and use them, deploy them as it were, to help our healthcare system. And you can even use anesthesia machines to help with ventilators. And so we're actually trying to amass the needed amounts before it comes to that crisis point.
Well, you're wargaming this. How many ventilators do we need in Georgia, and how many do we have?
I can't tell you off the top of my head how many we have or how many we'll need. We need to continue to monitor and work with the hospital system. One of our key partners is the Georgia Hospital Association, and they're in a better position to help identify those actual numbers. But we'll track that and continue to work hard to ensure we have extra on hand and don't get in that behind position. We are earlier in our epidemic than New York is. But so we have a chance to mitigate this in a way that perhaps they didn't. And I think that selective testing to try to find the highest risk individuals, aggressive contact tracing as we're doing in nursing homes and other high risk facilities, and also where there's a few number of cases, it's just saying some counties have relatively few cases, our epidemiology teams can get in there and stop spread quicker. We can't do that anymore where there's widespread transmission, but these community interventions will be our best bet there.
Yeah, we're hearing that folks who are asymptomatic can spread this, young people in particular, it would seem, because they seem not to be affected as badly. If that's the case, why wouldn't it make sense to test more widely to make sure that asymptomatic people aren't spreading this virus?
Well, obviously, the more you test, the better it would be. We are limited, as is every other state, by the number of tests we have. And I want to say something about young people. They do acquire the virus. They think they're immune, but they're not.
Right.
They do have symptoms. They may not recognize it as something serious because 80% of coronavirus cases are relatively mild. Like the flu or even less severe. Okay. It's that 20% of cases that are very severe, particularly in the elderly, particularly in those with chronic health conditions that we're trying to to prevent right now.
All right, we asked viewers for some questions. We got a lot of people asking over the phone in particular, can mosquitoes spread this when it gets warmer? I think I know the answer, but put people at ease on that one.
No, not to our knowledge, because this is not transmitted by, it's not a mosquito-borne or vector-borne disease. It isn't like Zika or West Nile. This is spread like the flu with respiratory secretions, so just like coughing or sneezing on someone, or even touching a dirty surface.
Okay. Everybody has seen clouds of pollen outside. Most everybody's suffering in some way or another with allergies. Does that make us more prone to difficulties with this virus if we contract?
Well, that's a great question, because it shouldn't make you more prone to the virus, but it may make you confused to think you might have it because you have some congestion or feel a little under the weather. But I think that the coronavirus usually has a fever, usually has malaise, just a bad feeling. And it is different and isn't treated with your anti-allergic medicines.
Well, Dr. Toomey, we appreciate your time, and thank you for being here and for all you're doing with the governor's coronavirus
Everything
task
I
force.
can do to help educate the public and help get their help in preventing this virus, I'm there to help.
Thanks so much. Jovita, back to you.
All right, Russ, thank you. This week, Atlanta's Mayor Keisha Lance Bottoms declared a state of emergency and ordered a stay-at-home order. Cheryl Preheim with WXIA TV joins us now to interview the mayor. Cheryl?
Home tonight as 11 Alive tries to support the statewide effort to work from home. So there might be a slight delay between my questions and the mayor's answers. Mayor, thanks for the time. You're part of the state coronavirus task force, and I understand you've made some recommendations on your subcommittee related to the homeless. Can you update us on those?
Sure, and thank you for staying at home. I want to thank the governor for asking me to serve on this committee, and this was a high-level working group consisting of people across the state, all with very valuable input. And also thank you to Catherine Marchman and John Keene for helping to lead this effort. What we did was come up with a list of 6 objectives to pass on to the governor as it relates to our homeless population. We know that our homeless population is a very vulnerable population just by virtue of the fact that they are homeless. They often have underlying health conditions that we've discussed that make them more susceptible to severe illness as it relates to the coronavirus. So what we did was to create a list of 6 objectives that we wanted to achieve. Those objectives included preventing additional people from becoming homeless, supporting enhanced cleaning, screening, and referral services, expanding testing for high-risk individuals in areas, establishing a reporting process specific to homeless and displaced persons, ensuring appropriate options for quarantine and isolation are available, and also ensuring that transportation options are available for people after they are released for the hospital. And I'm very pleased to say, as the result of the work that we've already done, we've had an angel donor in the downtown area who has donated a hotel to allow homeless individuals who may need isolation or quarantine to allow them a place to stay during that time. It also gives our service providers an opportunity to come in contact with the homeless population and make sure that we are making available to them additional wraparound services that may be helpful as we try and navigate them away from homelessness.
Yeah, so many people going through such difficult times. You were one of the first cities to implement the stay-at-home order, and I understand a lot of cities have been reaching out to you asking questions. Do you expect others to follow suit, and would you recommend that they do that?
If it were my call, I would have a stay-at-home order for the entire country, but obviously that is not my call. And I certainly understand and respect the governor's position that he is balancing diverse constituencies across the state, and their needs may be a bit different than ours. But as it relates specifically to the metropolitan Atlanta area, I think that many of the cities surrounding Atlanta certainly have many of the same issues that I saw in Atlanta. Many of our communities have underlying health conditions like asthma. I have 4 children in my house who are asthmatic. We know that's an underlying health condition. Whether it's high blood pressure or diabetes or respiratory issues or lupus or any number of other issues. And so I think especially for our more densely populated cities like Atlanta and our surrounding cities, I do think a stay-at-home order would be appropriate. But I certainly understand that there are many other cities throughout the state that are not navigating the same challenges that we are in the city, and I understand and respect the governor's decision.
We're hearing from medical professionals in different hospitals that they are already crowded and the ICUs are struggling. We heard from Grady on Monday that they were at the tipping point. Talk to us about plans that you have in place for some of our state's largest hospitals that are in your city.
And we have to remember that Grady is already in a compromised position because of the flood a couple of months ago. And on any given day, Grady may be near capacity. The anecdotal information that I received just yesterday was that Grady was around 90% at capacity in its ICU. So we have to remember, in the midst of this coronavirus, heart attacks don't stop, car accidents don't stop, any of the number of other things that send people into the ICU. So it is of tremendous concern to me. And by the projections that I've received from Dr. Carlos Del Rio at Emory, at this rate, we will exceed our capacity in the state by May 3rd. But certainly it's our hope that with these proactive measures in place that we can stop and slow down the spread of this virus. But in working with the governor, who has been a great partner in leading this effort, I know that there are plans already in place to expand our footprints at many of our hospitals, and I know that many sites have been reviewed as secondary places that we can house people if necessary. But it really is my prayer that it does not come to that in this state, but I certainly trust that with the leadership of our health partners and with the governor's leadership that we will be prepared in the city.
And it goes without saying, we cannot thank enough every person in our medical professional field, every healthcare worker, for all the work that they're doing day and night under really challenging circumstances. Mayor Keisha Lance Bottoms, thank you so much for the time tonight. And Jovita, I'll send it back to you.
Thank you.
All right, thank you, Cheryl and Mayor Bottoms. There's much more ahead this hour. We're going to hear from the director of the Georgia Emergency Management Agency, and the governor will be back to answer your questions. And here is the number for the Georgia Department of Public Health hotline. That number on your screen, 844-442-2681. Again, 844-442-2681. Remember, if you have any symptoms, call this number first before you go to your doctor's office. We're going to have this number for you again after the break, and we'll be back in 2 minutes.